Imagine lying on a reed mat in ancient Thebes, your leg broken from a construction accident. A physician approaches, his hands steady and confident. He doesn't just mutter prayers, he examines the fracture systematically, asks about your pain, checks your pulse. Then he sets the bone with practiced precision, applies a splint, and prescribes a mixture of honey and herbs to prevent infection. This scene could almost be from a modern hospital, except it's happening over 3,000 years ago. Today, we're uncovering the remarkable world of ancient Egyptian medicine, where empirical observation met spiritual belief, and where doctors performed procedures that wouldn't be matched in some parts of the world for millennia. Ancient Egyptian medicine was far more sophisticated than most people realize. While Greek physicians are often credited as the fathers of Western medicine, Egyptians were practicing systematic healthcare over 1,000 years before Hippocrates was born. They had specialized doctors, medical schools, surgical instruments, pharmaceutical recipes, and detailed anatomical knowledge. The Edwin Smith Papyrus, dating to around 1600 BCE but copying even older material, reads like a modern surgical textbook with its case-by-case analysis of injuries, examinations, diagnoses, and treatments. The papyrus describes 48 cases, organized from head to toe, with a rational approach that seems startlingly modern. For each case, the text follows a format: title of the injury, examination procedures, diagnosis, and treatment recommendation. The physician is instructed to say one of three verdicts: an ailment which I will treat, an ailment which I will contend with, or an ailment not to be treated, essentially categorizing cases as curable, uncertain, or fatal. This honest assessment of medical limitations shows a scientific humility that's admirable even today. Egyptian doctors understood anatomy better than their contemporaries anywhere else in the ancient world, largely thanks to their mummification practices. While embalmers and physicians were different professions, the knowledge gained from mummification, seeing internal organs, understanding body structure, filtered into medical practice. Egyptians knew the heart was central to life, though they believed it was the seat of intelligence rather than the brain. They identified major organs, understood that the pulse indicated heart function, and recognized that blood vessels connected throughout the body. The heart received particular attention in both medicine and religion. Doctors knew to check the pulse at multiple points: wrist, temple, chest, and understood that irregularities indicated illness. The Ebers Papyrus, another crucial medical text, describes the heart as having vessels leading to every part of the body, carrying air, blood, and other vital substances. While their understanding wasn't complete by modern standards, this cardiovascular awareness was revolutionary for the Bronze Age. Let's explore an ancient Egyptian medical practice, the House of Life or Per Ankh. These institutions served as combination medical schools, libraries, and hospitals. Young physicians trained here, copying ancient medical texts, studying under master doctors, and learning both the scientific and magical aspects of healing. The Per Ankh at major temples like Karnak housed extensive collections of medical papyri, recording centuries of accumulated knowledge. Training was rigorous and hierarchical. Students began by learning to read medical texts, memorizing recipes for medicines, and understanding diagnostic procedures. They practiced bandaging techniques, learned to identify hundreds of medicinal plants, and studied case histories from the papyri. The medical profession had specializations. Some doctors focused on eyes, others on teeth, still others on internal ailments. Herodotus, the Greek historian, wrote with amazement that Egyptian medicine was so specialized that each physician treats one disease and no more. Surgical procedures in ancient Egypt were surprisingly advanced. Archaeological finds have uncovered sophisticated surgical kits containing scalpels, forceps, scissors, hooks, and even drills. Doctors performed procedures we'd recognize today: setting fractures, treating wounds, removing tumors, draining abscesses, and even attempting trepanation, drilling holes in the skull to relieve pressure or treat head injuries. Skulls found with healed trepanation holes prove patients sometimes survived these procedures. Wound treatment followed principles that modern medicine validates. The medical papyri instruct doctors to clean wounds thoroughly, sometimes with a solution of water and natron, a naturally occurring salt with antiseptic properties. Honey, used extensively in Egyptian medicine, is now known to be a powerful antibacterial agent. Studies have shown that honey creates an environment hostile to bacteria, promotes healing, and reduces scarring. The Egyptians didn't understand germ theory, but empirical observation taught them that honey-treated wounds healed better. Suturing wounds was practiced with impressive skill. The Edwin Smith Papyrus describes using linen thread or even strips of fresh meat held in place with adhesive plaster made from linen and plant gum. For some wounds, particularly on the face where scarring mattered, doctors used a technique strikingly similar to modern butterfly bandages, pulling wound edges together with adhesive strips rather than stitches. The Egyptian pharmacopoeia was vast and sophisticated. Medical texts list over 700 substances used in medicines, plant materials, animal products, and minerals. Some of these remedies have proven medicinal value when analyzed by modern science. Willow bark, prescribed for pain and inflammation, contains salicin, the precursor to aspirin. Frankincense and myrrh, used for infections and wounds, have genuine antimicrobial properties. Castor oil, administered as a powerful laxative, remains in use today for the same purpose. Garlic held a special place in Egyptian medicine and diet. Builders of the pyramids received garlic as part of their rations, valued for giving strength and preventing illness. Modern research confirms garlic's antibacterial and antiviral properties. The Greek historian Herodotus noted an inscription claiming that workers on the Great Pyramid consumed large quantities of garlic, onions, and radishes, all plants now known to support immune function. The preparation of medicines was methodical and recorded in precise detail. Recipes specify exact measurements, preparation methods, and administration instructions. A typical prescription might read, to expel pain from the body, frankincense, incense, rushnut, cumin, and fresh bread. Grind finely. Eye diseases were particularly common in ancient Egypt, and ophthalmology became one of the most developed medical specialties. The combination of desert dust, bright sunlight, and parasites spread by flies created high rates of trachoma, conjunctivitis, and cataracts. Egyptian doctors developed numerous treatments recorded in the Ebers Papyrus. They prescribed eye drops made from honey mixed with various substances, applied poultices, and used makeup containing antimony and malachite, both of which have antibacterial properties. Interestingly, the famous Egyptian eye makeup served medical purposes beyond aesthetics. Scientists have found that the lead-based compounds in coal triggered the immune system to produce nitric oxide, which helped fight bacterial infections. The dark pigment also reduced glare from the intense sun, functioning like ancient sunglasses. Beauty and medicine were inseparable in Egyptian culture. Looking good and staying healthy were part of the same holistic approach to life. Dental problems plagued ancient Egyptians despite their relatively healthy diet. The bread that formed their dietary staple was ground with stone mills that left grit and sand in the flour. Over years of eating, this wore down tooth enamel to the pulp, causing abscesses and severe pain. Archaeological examination of mummies reveals terrible dental conditions, worn teeth, abscesses, and jaw infections. Yet Egyptian dentists developed treatments. They drained abscesses, prescribed pain-relieving mixtures, and even attempted to stabilize loose teeth by binding them to healthier neighbors with gold wire, an ancient form of dental bridging. One medical papyrus provides a recipe for toothache that reveals both scientific and magical thinking. The prescription calls for a mixture including cumin, incense, and fruit of the carob tree to be applied directly to the painful tooth. But the instructions also include a magical incantation to be recited during application, invoking gods to drive away the pain. This dual approach, practical treatment plus spiritual support, characterized Egyptian medicine. The intersection of magic and medicine might seem primitive to modern minds, but it reflects a sophisticated understanding of healing. Egyptians recognized that belief and mental state influenced recovery. A patient who believed they were protected by divine power might indeed heal better, what we now call the placebo effect, psychological impact on physical healing. The priests who practiced medicine understood that treating the whole person, body, mind, and spirit, produced better outcomes than addressing physical symptoms alone. Amulets were prescribed like medicine, The Eye of Horus, or Wedjat, was given to patients recovering from eye injuries or illnesses. Pregnant women wore amulets of Tauret, the hippo goddess who protected childbirth. These weren't just superstition. They were psychological tools that reduced anxiety and gave patients a sense of control and divine support during vulnerable times. The combination of practical treatment and spiritual reassurance was holistic healthcare millennia before that term was coined. Women's health received considerable attention in Egyptian medical texts. The Kahin Gynecological Papyrus, dating to around 1800 BCE, is the oldest known medical text dealing specifically with women's health. It covers pregnancy, contraception, fertility testing, and gynecological diseases. Some treatments were effective. Fumigation with certain herbs could ease some conditions. Others were more symbolic, like determining pregnancy by having a woman urinate on wheat and barley seeds. If they grew, she was supposedly pregnant, with the type of grain indicating the baby's sex. Contraception prescriptions reveal both botanical knowledge and trial-and-error learning. One recipe calls for acacia leaves ground with honey and applied on seed wool as a pessary. Modern analysis shows that acacia ferments to produce lactic acid, which has spermicidal properties. The method wouldn't meet modern standards of effectiveness, but the principle was scientifically sound. Similarly, they understood that certain plants could induce abortion or regulate menstruation. Knowledge passed through generations of healers. Childbirth was dangerous in the ancient world, and Egyptian medicine devoted significant resources to protecting mothers and infants. Women gave birth kneeling or squatting on special bricks, attended by midwives and female relatives. Protective spells were recited, amulets placed around the birthing space, and gods invoked for safe delivery. Midwives had practical skills too, knowing how to reposition breech babies, manage hemorrhaging, and cut umbilical cords at the proper moment. If complications arose, physicians could be summoned, though often there was little they could do with the medical knowledge available. Post-birth care included treatments we now recognize as beneficial. Babies were washed, massaged with oils, and breastfed immediately, practices modern medicine recommends. New mothers were prescribed nutritious foods, rest, and herbal remedies to support recovery and milk production. The 40-day purification period after childbirth, a religious requirement, essentially mandated postpartum rest and recovery time. Egyptian diagnostic methods combined observation with logical deduction. Doctors were trained to ask detailed questions. When did the pain start? Where exactly does it hurt? What makes it better or worse? They observed skin color, examined bodily fluids, smelled breath and wounds for signs of infection, and palpated the body for abnormalities. The Edwin Smith Papyrus instructs physicians to look for specific signs: swelling, heat, discoloration, loss of function, and to compare findings with documented cases in medical literature. This evidence-based approach was remarkable for its time. Rather than attributing every illness to divine punishment or demonic possession, Egyptian doctors recognized that many conditions had natural causes and predictable progressions. They distinguished between treatable and untreatable conditions, understood prognosis, and documented treatment outcomes. This created an accumulating body of medical knowledge that improved with each generation. However, Egyptian medicine had significant limitations rooted in religious beliefs. They famously believed the brain was useless. Embalmers discarded it during mummification while carefully preserving other organs. Since they thought the heart was the seat of intelligence and emotion, they never understood the brain's crucial role. This meant conditions we now know are neurological, epilepsy, stroke, mental illness, were often attributed to supernatural causes and treated primarily with spells. Ancient Egyptian medicine was a fascinating blend of empirical observation, accumulated knowledge, and spiritual belief. They developed surgical techniques, pharmaceutical recipes, and diagnostic methods that represented the cutting edge of ancient healthcare. Many of their remedies contained genuinely effective ingredients. Their systematic approach to documenting cases and outcomes created medical literature that influenced Greek and Roman medicine, which in turn shaped the foundations of modern Western medicine. But perhaps most impressive was their holistic understanding that healing involved more than just treating symptoms. They recognized that hope, belief, community support, and spiritual peace contributed to recovery. In our modern age of specialized medicine and technological interventions, we're rediscovering what Egyptian doctors knew 3,000 years ago, that healing the whole person, body, mind, and spirit produces the best outcomes. The next time you take aspirin for a headache, apply honey to a wound, or visit a medical specialist, remember that these practices have ancient roots stretching back to physicians who worked along the Nile, combining careful observation with compassionate care, advancing human knowledge one patient at a time. If you found ancient Egyptian medicine as fascinating as we do, subscribe to Trail of Shards for more deep dives into the knowledge, innovations, and daily realities of ancient civilizations. Give this video a like if you learned something that surprised you about ancient healthcare. Until next time, keep exploring the remarkable achievements of our ancestors.